Welcome to today's webinar, HIPAA Security in the News. I'm Roger Schindel, your presenter today. The idea behind today's webinar is to provide some insight on areas of HIPAA that you need to be concerned about by looking at some recent breaches and investigations that have been published by the Office for Civil Rights, or OCR. Today's learning objectives will include working with business associates, handling paper records, malware, software vulnerabilities, and finally, activities of counties. The lessons we'd like you to take away will pop up over and over again are the requirements to conduct a risk assessment, to develop and maintain your security and privacy program, and working with business associates. But probably the most important of all is that you continue to train, and conduct more training. For our purposes to define security, we're going to talk about what you'd find in parts 160 and 164 of the regulations. And we're going to limit it to things that you would find when you conduct your security risk assessment. In the news means where the Office for Civil Rights has published a resolution agreement on their breach portal. Here is the URL. It used to be called the HIPAA Wall of Shame. I guess they didn't find that to be an appropriate name. And now it's just called Breach Portal. Additionally, here's the link to the resolution agreements that OCR provides, or HHS. And you can always go to those and see what is of interest to HHS regarding violations and breaches. So the first scenario I want to talk about relates to working with business associates. This one's interesting because it's the first time that both a covered entity and a business associate were fined for the same breach. In this case, Care New England Health System, or CNE, provided support for its subsidiary and affiliated covered entities, including member hospitals in Massachusetts and Rhode Island. In this case, they were business associates, one of which was Women and Infants Hospital of Rhode Island. Women and Infants experienced the loss of unencrypted backup tapes containing studies and PHI of approximately 1,400 individuals, including names, dates of birth, exams, physician names, and in some cases, social security numbers. So when WIH was providing business associate agreements to Care New England, it was effective as of March 15, 2015, and wasn't updated until August 28, 2015, well after the date that was required for business associate agreements to be updated, which was September 23, 2012. Based on not having a valid business associate agreement in place at the time of the breach, CNE had a settlement which included a payment of $400,000. Remember, CNE was the business associate, even though the covered entity, Women's, was the covered entity. A comprehensive action plan was also required. At the same time, Women's was fined $150,000 as the covered entity in the case. The Attorney General for the state of Massachusetts deemed that the state fine of $150,000 was sufficient, so HHS, Human Health Services, decided not to levy additional fines or penalties under the federal laws. Another example of the issues working with business associates is North Memorial. In this case, North Memorial Hospital was a comprehensive, not-for-profit healthcare system serving the Twin Cities of Minnesota. Originally, North Memorial was investigated after a breach was reported. An unencrypted password-protected laptop was stolen from a business associate with approximately 9,500 names. The laptop was password protected, but was not encrypted. When OCR investigated the breach and indicated through the laptop, North Memorial had given the business associate access to 290,000 names, 30 times the initial records that were reported in the breach. Additional investigation found that North Memorial failed to complete a risk assessment. So the fines levied again were worth $1.5 million. Additionally, North Memorial was required to develop and organize an organization-wide risk assessment and risk management plan, and also was required to train workforce members. You can hear this over and over again, that the lessons to be learned from these breaches is the requirement to do your risk assessment and to create policies and procedures and to train on those specific policies and procedures. The lack of not complying with those regulations is always going to cause you problems when you're being investigated by a regulatory agency.